We've known for so many years that clinical markers and risk stratification of smoldering myeloma is important because we want to know who should be treated from smoldering myeloma to active disease, who's going to be at risk, and can we prevent that by early therapeutic interventions. And we know that the 22-20 model is a great clinical model, but it's missing something. It's missing the genomic data. It's missing the biology of those patients. So we went back and looked at all of our whole exome sequencing and targeted sequencing data, but also looked at RNA sequencing in some of those patients, and we collaborated with the Mayo Clinic and with Dr. Gareth Morgan, on looking at all of their data and asked the questions, can we develop new classifiers based on the DNA, not on the RNA, but can we find new DNA classifiers that tell me who is at risk for developing multiple myeloma from smoldering disease? And we found indeed several subclassifications that put together different groups of patients. So you may have a hyperdiploid, but you also have MYC alterations that will put you at risk. You may be hyperdiploid, but you also have a 1q that puts you at risk. So by grouping together in a unsupervised method, how are the genomic factors that lead to progression, now you can identify better who is at risk and hopefully develop this as a new next generation sequencing targeted panel, and you can tell patients if they are at risk or not to develop multiple myeloma.